The topic for today will be humidification. Uh, Before we start, I just want to ask anyone has read this topic before or any words related to this topic? What should be the things to be learned related to this topic? Anyone, please? Nobody? Actually, whenever we want to study or grab any topic, we should be just knowing that what are the things which may be. So actually, humidification, why it is important? Because whenever we are giving our anesthesia, breathing, just all this airflow which is going, usually when the patient is breathing by himself or herself, there is a system which is there from nature, that there is nose which usually humidified the gases, and when it is reaches the lower airways, it is already moist and it is not causing dryness or crusting of the airway. Okay, so this is one thing. So the concept of this humidification, or when what we want to know is that if the overall environment related to like with reference to the gases as well as the OR environment, because if air OR environment is also very dry, there is another thing which can create the problem. So that thing is related to the generation of static electricity. Okay, we will not I will not go in detail of that topic, but actually there are static current or a static electricity which is generated ions in, and it is very important that there should be a baseline humidity so that this is does not creates explosions and fire. Okay, so that is related to the OR environment overall. But in addition to that, we need to humidify the gases because we are bypassing whenever we have put an airway like supraglottic airway or endotracheal intubation, we have bypassed the natural system which is there, and now we need to replace it with something to avoid um, the bad effects. But at the same time, if we are over humidifying something, there are some problems which can occur, and it is related to like creation of bacterial flora, because humid environment will be good for their growth. Okay, so that's why we have to get a balance, and especially if this effect will be more, maybe it is not so pronounced if we have a small short surgery, but as the time of surgery will be prolonged, or if we consider this thing in the ICU, if the patient is prolonged ventilated for a long time, prolonged ventilation, this effect will be even further more important, and it will also lead to the heat loss. Okay, because heat will be utilized for this humidification of the gases which will be occurring through the airway. Not only it will lead to more heat loss, and it will also result in the effects because of dry gases. Okay, so this is the baseline concept, and then some further concept that what is humidity. You should be knowing what is humidity, and humidity is either measured in the form of absolute humidity or relative humidity. Okay, relative, of course, relative to something which can be the maximum one, and absolute is the absolute amount of vapors which is there in the gas. So we will see how can be calculated. Please mute your mics. Okay, it's a request because I am distracted by this thing. So this is the basic concept. Then you should be knowing how to measure. So how to measure this humidity. So for that, there is something which is called as hygrometer. Okay, so this will be the other point you should be knowing. Then there will be humidification. Okay, so there will be certain methods by which we will be getting the humidification. One of them will be active and one of them will be passive. Okay, and then there will be different types of active and passive humidification, and we will rate them according to their efficiency. Okay, so of different system. Okay, so this is just an outlook of there will be a number of ways to do active humidification and passive humidification. Okay, so usually the ways for different creating different maybe will be either there will be heating system, okay, or also cooling. Okay, there will be some system with nebulization. Okay, or there will be some filter which will be absorbing and then releasing. Okay, that occurs which is actually the most common one which we use in HME filters. So usually it will be the main either there will be some heating system, the cooling system, or some nebulized system, or presence of filter. So this is the overall concept. And now we will be looking at the text, that how it is being written. But usually, make your habit, whatever topic you are trying to read, just try to have a concept of or discuss with someone that what are the pearls, what are the targets, what are the goals, what are the objectives, what are the things to do. You can use uh, different words to explain this thing, because when you are just opening a holy book and you are trying to read each and every line, you don't know your enemy. Okay, so if you know what is your enemy, what are the targets, then you like it is just like trying to see without glasses. If someone uses glasses to see things clearly, he is just trying to look at something without glasses. Okay, so when you know what is your enemy, when you have the glasses, you will be looking at the things in a better way. Okay, and you will not waste your time, or the other way, maybe you will not miss any important point. Okay, so so usually, if we just think what is absolute humidity, as I told you, it is the amount of water vapor within a gas and is measured in gram meter cube or milligram per liter. Okay, so this is the absolute humidity. But usually, what we frequently use is relative humidity. Okay, is a ratio that you are comparing the humidity in your sample with reference to the maximum, is a ratio of the amount of measured water vapor in a gas divided by the saturated vapor pressure at a given temperature. Like what is the maximum? Okay, which can be there by comparing it to the one which is there at that moment. Okay, as the temperature of a gas increase, the amount of water vapor it can hold, and therefore its saturated vapor pressure increases. So this is the graph in which they are showing that as the temperature increases, saturated vapor pressure increases. So at the same at the same pressure, the amount of vapor will be more. Okay, so this is the basic concept. And then usually we want to keep the humidity around 50 to 60%. Okay, indoor at air at 20 degrees centigrade has a relative humidity of 50 to 60%. As gas passes through the nasopharynx, it is heated and fully saturated to an absolute humidity of 44 gram per meter cube. The point of full saturation during normal respiration is the isothermic saturation boundary, and it is just above the carina. Okay, the nose is well adapted for increases relative humidity as it is a highly vascular area, and the presence of nasal turbinate increase the surface area for heating and humidification. So this is occurring normally. Airway epithelial cells secrete mucus. This lubricates the airway and provides a medium for trapping inhaled particles and pathogens. The mucus is moved towards the nasopharynx by the rhythmic beating of cilia, and debris is cleared. This is what is happening normally. Okay. Bypassing the nasopharynx with either an endotracheal or tracheostomy tube delivers cold, dry gas to the airway. Okay, the air the air is humidified by the evaporation of liquid from this mucus layer. So this will result in drying of the mucus and heat loss due to the latent heat of vaporization. Loss of heat through this mechanism is of importance in pediatric practice. Children, especially neonates, have a high minute ventilation to body surface area ratio, and ventilation for 90 minutes with an unhumidified air can lead to fall in body temperature of 4.5 degrees centigrade. Actually, this is the things which I gave you a summary, that whenever this system is bypassed and you are your airway is facing the direct effect, the air which is coming will take its component of humidity, and this will result in dryness. And at the same time, there will be heat loss as well. Okay. Inadequate humidification of airway leads to thick, tenacious sputum. This is difficult to clear and can lead to mucus plugs that can block endotracheal tubes and even airways. So that is the importance. So if someone asks you what is the importance of humidification, this is the words which are important. This may expose patients to distal atelectasis, vacuum mismatching, and increase risk of infection. This is also the reason of blockade of tube, one of the reason of blockade of endotracheal tube, which when we keep it for a longer time. Okay, exposure time increases, so does the damage. Prolonged exposure to unhumidified gases can lead to loss of cilia numbers and function. Airway keratinization and airway necrosis. During ventilation in critical care, these component complications can lead to increased incidence of VQ, ventilator-associated pneumonia, increased length of breathing, and prolonged ventilator time difficult, meaning also this one. Ultimately, the tracheal stenosis can also occur if these changes are occurring. Fibrosis occurs, and this is one of the reasons. Okay, humidification also plays a vital role in operation theater. If the relative humidity is too high, it becomes uncomfortable for the staff as heat loss through sweating is reduced. If humidity is too low, there is risk of fire and explosions. Okay, low humidity has also been seen associated worsening of rhinitis and asthma. The balance is has reached it has 50.
Hello, hello.
You see, this is also funny thing. People don't care whatever we say. Anyways, so actually, this is what I will just give you an example when I am facing, because Riyadh, where I am residing, it's the environment is very, very, very dry. Okay, if someone coming from other part of the world, like I remember, I was living in another city and I came to Riyadh at that time, visiting here, and after one day, because this occurs to me, because I my airways was drier and I was uh, itching, and there were crusts in the nose after 24 hours. This is one thing. And another thing, because it is dry, so every now and then, whenever we are touching a dry surface, we get shock and we think that there is a current. So it is occurring daily in Riyadh. So now we are used to it. And of course, our body has adapted to it. So at least this rhinitis and asthma does not occur in the way which I faced for the first time. Okay. So this is one part of the discussion which I have told you. Then the other things, that how to measure it. So as I told you, the equipment, whatever the measure will be, the main purpose is how to measure. Either it will be measuring in the relative, or it will be measuring in the absolute. So one of them is hair hygrometer. Human and different types of animal hair have been used in hair hygrometer. It works with the principle that as humidity increases, the length of air increases. The hair is tensioned so that ends remains fixed, while the other is free to expand over a pre-calibrated scale and accurate up around humidity of 30 to 90%. So this is its limitation. So then wet and dry bulb hygrometer. So two mercury thermometers are used. The dry bulb is in equilibrium with the ambient air temperature. The wet bulb is suspended in water. Okay. So wet bulb is cooled by the latent heat of vaporization as the water evaporates. The rate of evaporation is proportional to the relative humidity above the water. Higher humidity causes less water to evaporate, and there is less cooling on of the wet bulb. The temperature difference between two bulbs can be referenced using set tables and relative humidity calculated. Like they are saying that they have put one in the ambient air and the other one in the bulb. So as if there will be more humidity, less amount of water will go up. Okay. So there will be less change in temperature, and this temperature change will be calibrated and it will be measured. So similarly, uh, you can read the details about it. I just want to give a concept. Okay. Regnard's hygrometer. Air is passed through a silver tube containing ether, which causes the air to cool. Once the air reaches its dew point, yes, dew point. I had read it here somewhere. I will explain to you. Let's just like because I find this the temperature at which the relative humidity of the air exceeds 100% and water condenses out of vapor phase to form liquid. Again, I say that it is the temperature at which like water, the air is so much full of humidity that it becomes converted into water. So this is the dew point, the temperature at which the relative humidity of air exceeds 100% and water condenses out of the vapor phase to form liquid. This is what is called as dew, which occurs in cold weather. Okay. So coming back to the text which we were, so here they were saying air is passed through a silver tube containing ether, which causes the air to cool. Once the air reaches its dew point, 100% humidity, condensation occurs on the outside of the tube. Relative humidity can be calculated from the temperature of the dew point by using set tables. This is most accurate measurement of relative humidity. Okay, because at the temperature where it will be starting becoming liquid, that will be the reference point, and then they will calculate through the through that set point with the relative humidity in that air mixture. Okay. Absolute humidity can be measured by a mass spectrometer and transducer. Transducers work on the principle that electrical resistance or capacitance changes with increasing humidity. Mass spectrometer measures breath by breath humidity in gas samples but require no condensation in the sample line. So this is just for your information because no, even if it is asked in the written, you should be just having a concept. MCQs, it can come because of course the people who are preparing for EDA exam or any basic science exam, you will be asked. But in the oral part or in the clinical practice, you should just have a concept because practically speaking, we are not using these things. Okay. So airway humidification, which is occurring naturally, is cheap, simple. Ideal humidification device, what we are using, it should be cheap, simple to use, does not increase the risk of infection, humidifies and heats gases to physiological conditions, does not produce significant resistance because whenever we are placing something in the circuit or in between, it will increase the resistance. So the work of breathing will increase. So ideally, it should be cheap, simple, and infection rate should not be increased. And it should be within the, because if, for example, you are using a heating system, it can cause scalding burns. Okay. So you have to take care of it. And then the size of water droplets provided by humidification devices are of importance. The ideal size is 1 micron. This is transferred to the alveoli. Large droplets of 5 micron deposits in the trachea and have no benefit for the distal airways. So this is the MCQ that it should be not be a very high size. It should be around 1 micron so that it should be reaching the alveoli. Droplets of 20 microns and above are responsible for condensation seen of ventilation tubing, which is coming the water from where it comes. It is not coming through the patient. It is coming through the humidification system or humidification which is occurring. Current devices can be classified as active and passive, as I told you. Passive do not rely on external power or water, or active system. There is no heating system or cooling system or any electric system. So what is this is actually the most common. So they have written in the first HME filter. Filter consists of a membrane, commonly paper, ceramic, or polyurethane foam, coated in a hygroscopic material. I will show you this just a second. What is hygroscopic material? Okay. Mm, There are two sort of materials. One is hygroscopic and one is hydrophobic. So hygroscopic is what is retaining the water. Okay. And hydrophobic is phobia. So phobia is the thing which is repelling. So whatever high material will be there, it should be from one side it will retain, and from the other side it will give. So actually, one side of the this filter will have hygroscopic material, so coming from the expiratory side. So the hygroscopic material will be on the side, it will take the water, okay, and it will it will be transferred to the other side, from where when the gases are coming, that side is repelling side, so the air which is coming will take that water. So this is the working principle of what we say as this system. So they will say, again I will read: HME filter consists of a membrane, commonly paper, ceramic or polyfoam, coated in a hygroscopic material, calcium or lithium chloride. This is the material, suspended in a lightweight plastic casing within an inlet or outlet. Warm humidifier is expired and condenses on the membrane. This has hygroscopic material. Okay. As cold dry gas is inspired, it passes over the filter, becomes humidified and warm. It takes 20 minutes to reach maximum efficacy, produce a relative humidity of 70%. Okay. So this is the most simple way I can explain. One side is hygroscopic, it is receiving, okay, and the other side is hydrophobic, so it is giving. So that's what happened. Simple and cheap to use, can incorporate a microbacterial filter, which is HME filter. Okay. So bulky, but it needs, if, especially if you are using in a patients with some respiratory problem, it can still increase the resistance. So if you in some desperate situation, when you are getting too much high airway pressures, one way will be to remove the HME filters for that time. Of course, you have to outweigh risk versus benefits. But if you are getting too much resistance and you are not able to ventilate, you can remove one of the filter which you are using. Okay. So because these days they are using actually three filters with the COVID era. One is from the expiratory limb, one is in the inspiratory limb, and one is just at near the patient. So to be very sure that nothing is going from the machine to the patient or from the patient to the machine. Okay. So other, if at any time, if anyone wants to ask any question, he or she is welcome. Okay. I'm just trying to make this boring topic as easy as possible for me, because it's not my very strong point to teach or discuss basic sciences topic, but because I have not done it before, so I'm just trying to fill this gap which is there. Okay, gases can be bubbled through water to increase humidity. Passing gas through water at room temperature causes the gas to cool due to latent heat of vaporization. The water bath can be heated. This improves the efficiency of the device and also reduces the incidence of bacterial colonization. So high relative humidity can be achieved, forms inspired gases. This is the advantage. Bacterial contamination. If the temperature is not, if it is an optimal temperature around 40 degrees centigrade, 45 degrees centigrade, it will increase the risk of bacterial contamination. But if you increase it more than 60, then it will prevent. Okay. Risk of aspiration of water into the airways, risk of airway burns with high temperatures. Next is the better way is nebulize. So nebulize use of Venturi principle, okay, which implies the Bernoulli's effect, that if the pressure is decreased, there will be entrainment of the air. So the gas at high flow passes through a constriction, causing the gas to accelerate and reducing the potential energy, allowing other gases or liquid to be entrained. So this is the working principle of nebulizer, whatever we are using. Okay, this can include medications, or in case of humidification, water vapors. Okay. The size of water droplet produced by nebulization determines where in the airway it is deposited, as we discussed, that it should be around 1 micron. If it is more than 5, it will be in trachea, or if it is more than that, it will be creating problem. Standard nebulization nebulizer produce droplets of 5 microns in diameter, and these are deposited in the upper airway and trachea. In fact, efficacy can be improved by passing the droplets over an anvil, which will further reduce particle size. The most efficient form of nebulizer is ultrasonic nebulizer. Okay, has a transducer immersed in water and vibrated at very high rate, produces 1 to 2 micron. So this will be the MCQ question, and this table can be asked in some, that what is the efficacy. So the most efficacious is ultrasonic, then mention. Okay, so this point you should be knowing that cold water bath 10, then 20, 25, then 40. This is absolute humidity. Okay, so just let me see the other, because this is the main concept. Okay, this is the main concept, that how to measure, what are the uses, what are the advantages, what are the disadvantages. I will share these articles to you. Okay, and just let me see anything extra. These are the sources. This is equipment book, because this topic, I think it is better to read from the equipment book. But all these sources are there. There are around 2 to 3 articles. Just a second, please. This one, humidity. This is. I will share these articles with you, and you can have a detail. But I have just given you a baseline concept about this topic. Anything you can want to ask, or anything we can add? These are
Assalamu
some.
alaikum.
Walaikum assalam.
Sir, what if we do over humidify a patient or a circuit, or over nebulization sometimes, if a
It
patient
will it
needs
will it will cause, it can cause, a first of all, a increase resistance, and it will cause chances of bacterial contamination. These will be the problems which will occur.
and the second question is, sir, the common filter we are using in ventilators or in our anesthesia
This is
circuits,
HME filter, as I told you. This is the one, that one side
and
has.
yes, but the filters we are using, are those the same kind of filter, or HME filter is a specific filter
HME
for?
filter, same. You see, the layer of foam, it is generally coated with a hygroscopic
Yes,
salts, with calcium chloride
yes,
or lithium or whatever. Okay,
yes,
it's the same
yes.
one. They have efficacy of around 60 to 70% relative humidity, which is required.
Okay.
Okay. So I think I will just finish. I will just share the page numbers of these books. Usually these books are there in this folder. You will go to the books, and then all the topics which we will be discussing in coming days will be from this basics review books folder, this physics equipment folder. Usually you will find a number of books which are there, because you will not find this topic in your other holy books which you are reading, Morgan, Sharif, and it is not written in a way you should be knowing. Okay, so I will suggest you to read from here. And then, of course, the articles you will find, as I showed to you. This is one of the tutorial, anesthesia tutorial of the week, 362 number. And then this is CEA CCP, this BJ education article. Okay, so I think that's it, inshallah. Our next topic most probably will be, I will just share with you. I will just think, and I will let you know. Okay, so it,
Zishan, sir, if you start a few topics on ventilators or waveforms, sir, it would be
I will try to do it.
very
We
better.
have done, we have started basic sciences topic. We had done
Yes,
scavenging. This is, we had
yes,
done low flow anesthesia. This is our third topic in this series. So I will try to do pulse
humidification.
oximeter and tidal CO2 one by
Yes, sir.
one, the basic sciences
ठीक-
topics. Okay,
ठीक. Thank you so much.
how
Thank
to measure blood pressure, different types of
you.
blood
Yes,
pressure
yes,
equipments.
yes.
So that's it. Okay. So thank you very much, all of you. And I will
Thank
request you that that all the whatever I have discussed yet, it's all there in the YouTube. You can follow it, you can see it. And because I have to announce this thing, that I'm not doing it for any financial purpose. So it's none of my business whether you see it or not, don't see it. I'm not going for channel monetization, or you see, actually, it's not been monetized. So that's what more important for me to tell you, so that you understand more that if whatever I have told you is for you, not for my personal benefit or personal gain. Okay. So usually all for the people who other than our language. So this is all the discussions which are being done in English, and rest of the folders you can find. Okay. And there was a question. Yes, I just forgot to answer here. Just a second, please. Is hygroscopic side at patient side? Actually in the filter, it should be on the expiratory side. So yes, it is towards the patient side. Okay. So, Dr. Johib Hassan, I think you are new to the group or you have not attended before. I am doing it since last at least 1.5 years. And whatever these number of discussions have been done, of course, I am not very good in this editing and everything, and nor I am in favor of making very beautiful presentations. I'm a more comfortable, of course, in clinical sciences, because basic sciences we don't read every time. Of course, when you will become a clinician, you just have a basic concept what you are using. And I have never seen in anywhere in the world, but wherever I have worked, I have not seen other than HME filter. So where they are using, maybe this is more of theoretical, but you should have a concept. And I have just tried to given you the basic concept. Of course, the details you can find in the sources which I have told you. Almost all the topics has been covered. A number of people ask about different exams and everything. So it is there. ENT, some airway problem, non-operating room anesthesia. Some you
Assalamu
will find
alaikum.
some.
Uh,
Walaikum assalam. Yes.
yes, I have attended the last three classes only.
Okay.
Not the last three classes actually. I have attended it on the. I have seen it on the YouTube. Timing is usually the problematic, and you might hear my childs are already talking with me.
No
That's
problem.
why
No problem.
it's not possible all the time to participate in the meeting. But
Sure.
I'm following for the last 3 to 4 lectures in the YouTube. And
Okay. Thank you.
regarding the humidification system,
Mhm.
in the high flow nasal cannula, what kind of humidifying device is usually used?
Yes.
Is it heated
I
water bath?
think I think it should be some water bath or something. I don't know exactly. Your
But
question is
there is
absolute
not
valid.
actually 60-degree temperature. I have not seen the 60-degree temperature marks in the high flow nasal cannula that usually uses. It's around
Mhm.
40 degrees centigrade. And
Mhm.
60 degrees centigrade sounds too much heat for the airway
I
actually.
actually this is that's why your question is absolutely valid. But I think you see this is what is written here also. Uh, but they are only mentioning with
Our
reference
body
to the.
temperature is not that much high, na?
No, you're right. You're right. But I'm saying that the this this is with reference to the chances of bacterial contamination. This is not the result. This is the
So what
system which is
should we
there.
do if we are asked that what should we do to avoid the bacterial contamination of the high flow nasal cannula? As high flow nasal cannula has uh, had been used widely for the management of the COVID-19.
Mm, Actually, you are absolutely right, but I have very little information about high flow nasal cannula because I have personally never used it. Because in Saudi Arabia, we are away from ICU. I'm purely doing anesthesia for last 8, 9 years, and this high flow nasal cannula
So,
is only discovered in this time. Okay, so unfortunately, I'm short
uh,
of ideas about how is the functioning of high flow nasal cannula. Let me see. I will. You can just drop a message on WhatsApp to me. Okay. So I will just try to
uh,
find out the answer for this question. I think there is this on high flow nasal oxygen therapy. Maybe we can find the answer over here. Humidity is
well, I
provided
will
by
send you a picture
disposable.
of the high flow nasal cannula device that we have in our ICU setup, and I will try to see again that
Do
what
share
are
it with
the
me. Do share
okay.
it with me. That thing is that I am a very open person. I am just trying to do whatever is in my hand. And believe me,
Okay.
that discussing a basic science topic is very, very difficult. I'm inviting people around me. Nobody else is there to help me out. Okay, so this is the basic
And,
sciences topic I
and
have not
another
discussed.
thing, another another thing, while you were telling us about those ways to measure the humidity, there are some hygrometers or something. Usually, I have never seen them. So you have had another slide with those pictures of those devices. If you could show these devices and draw something with the blank pages to let us know how these devices works, it would remain in our
Yes,
mind
I
for
will
longer period.
try. I will try to improve it. Okay, but actually I
Thank
have
you.
told
Thank
you that I have tried to given you the basic concept, because practically nobody use it. I have never seen these things, believe me. I have only
Yes,
seen
yes. Every
channel
time
filter.
before the exam, I read it and forget it after the exam. Actually.
Yes, you see here we see they have put some information here about this high flow nasal. So humidity is provided by disposable vapor transfer cartridge bubble humidifier, okay, or heated plate modifier humidifier. That is what we were discussing. A vapor
Yes, yes.
transfer
Yes.
cartridge is a patented device that surrounds the gas flow. Water diffuses through the cartridge, is heated and passes into the gas flow as vapor. The bubble
The temperature
humidifier
is
used,
between 33 to 43 degrees centigrade. The
yeah,
second paragraph
yes,
or second
because I
row.
think I think this is with reference to high flow. Okay,
Yes,
with
yes.
other things, I think this is only the system. If there the system which is there, which is giving the humidification, if that system temperature is decreased, there will be chances of bacterial colonization. That's what I understood. You understand my answer? That the
Yes,
system
yes.
which is producing the outflow, of course, will not be 60 degrees centigrade. It will burn everything. They are only talking about the system which is creating the vapors. Because, for example, if it is cool, it is a cold, then there will be chances of because 40 degrees centigrade will be very favorable temperature for the bacterial growth. So that's what they said, I think, that the system which is producing the vapors should be more than 60 degrees centigrade to avoid bacterial colonization. That's what my concept is. Okay.
Okay.
So
Thank you.
I will share this well as well. And thanks a lot to listen from you. I will be very happy. You just drop a message on my WhatsApp. You have my WhatsApp, so just share it to me on search. What need to be type on YouTube? It's anesthesia knowledge. It's anesthesia knowledge, and if you are on my WhatsApp channel, WhatsApp group, I always share it. So it's anesthesia knowledge. Okay. So thanks a lot, and I'm thankful, Dr. Johab, for your participation. Okay, thanks a lot. Is it Sorat from Karachi? Is this Sorat from Karachi or someone else?
जी जी sir. I'm from
Wow.
Karachi, Dr. Saurabh.
After passing FCPS, if someone gives the time, salute to you, because after passing the exam, no one comes.
No, sir, inshallah, I
So
will come daily.
no, 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 no,
I will
no,
try
no
to come
problem.
daily.
Don't, no need to be embarrassed. But I'm telling you that the one person who passed the exam, if they happen to come, there are special
WhatsApp
thanks for them. Okay.
Okay.
Thank you. Bye bye. And any question later on, if you want to suggest or ask anything, please do contact me on WhatsApp. Okay. Bye bye.